As a urologist and andrologist with extensive experience in sexual health, I have the privilege of sharing with you a fascinating journey through the universe of human sexuality. Over my 15 years of clinical practice, I have observed how the scientific understanding of this topic can transform lives and relationships. In my office in the city of Chicago, I see people daily with questions, concerns, and curiosities about their sexuality. One of the most frequent questions is about how our body responds to pleasure and why intimacy is so fundamental to our overall health. The answer lies in an intricate biochemical dance that occurs within our bodies. When we experience sexual pleasure, our brain becomes a true powerhouse of neurotransmitters and hormones. Dopamine, known as the pleasure neurotransmitter, is released in significant amounts, providing sensations of well-being and reward. This same system is responsible for making us enjoy a good meal or celebrate a professional achievement. But the chemistry of pleasure goes further. During sexual intimacy, our body releases endorphins, the body's natural painkillers. These substances not only reduce the sensation of pain, but also promote a state of relaxation and satisfaction. This is why many people report improvement in chronic pain and migraines after moments of intimacy. One of the most interesting aspects of sexual physiology is the role of oxytocin, affectionately called the love hormone. During sexual activity, and especially during orgasm, oxytocin levels skyrocket, strengthening the emotional bonds between partners. This hormone is the same one that promotes the bond between mother and baby during breastfeeding, highlighting its fundamental role in human connections. In my clinical experience at the Mayo Clinic, I participated in research that demonstrated how regular sexual activity is associated with surprising health benefits. The immune system, for example, receives a significant boost. Levels of immunoglobulin A, a crucial antibody for our defense against infections, increase considerably in sexually active individuals. Cardiovascular health also greatly benefits from sexual activity. During the act, our heart rate rises, providing moderate cardiovascular exercise. Studies conducted in collaboration with cardiologist colleagues have shown that people with active sex lives have a lower risk of developing heart problems. What many don't know is that sexuality also positively impacts our mental health. During my lectures at international conferences, I always emphasize how sexual pleasure is linked to reduced levels of cortisol, the stress hormone. This hormonal regulation contributes to more restorative sleep and a more balanced mood. A fascinating aspect I observe in my clinical practice is how understanding these biological mechanisms helps people overcome taboos and shame related to sexuality. When we explain that sexual pleasure is a natural and beneficial function of the body, many patients feel more comfortable exploring and accepting their own sexuality. During my specialization at Harvard University, I had the opportunity to study how different cultures approach sexuality. It's interesting to note that, regardless of cultural context, our bodies respond similarly to sexual stimuli. This universality of human sexual response shows us that pleasure is a fundamental part of our nature. Brain neuroplasticity, our ability to create new neural connections, is also influenced by sexual activity. During moments of intimacy, specific areas of the brain are activated, strengthening neural circuits related to pleasure and well-being. This discovery has important implications for maintaining cognitive health throughout life. In the next chapter, we will explore how this scientific knowledge can be applied to enrich relationships and promote a more satisfying sexual life. We will discuss practical strategies to maximize the health benefits of sexuality, always based on scientific evidence and proven clinical experiences. In my journey as a sexual medicine specialist, I have learned that each individual is unique in their expression of sexuality. During my residency years at Mount Sinai Hospital, I had the privilege of caring for people from the most diverse backgrounds and sexual orientations, which allowed me to develop a deep understanding of the breadth of human sexual experience. One of the most significant discoveries of modern sexual medicine is that there is no single, normal standard for sexuality. Each person has their own rhythm, preferences, and needs. This understanding has revolutionized how we approach sexual health in the clinic. During my consultations, I always emphasize that diversity is a natural and enriching characteristic of human sexuality. A fundamental aspect I address with my patients is the issue of sexual orientation. Science has conclusively demonstrated that sexual orientation is an intrinsic characteristic of the individual, determined by a complex interaction of biological, genetic, and environmental factors. In my lectures for healthcare professionals, I always emphasize the importance of providing welcoming and prejudice-free care. The expression of sexuality also varies greatly across different cultures and historical periods. During my specialization abroad, I had the opportunity to study how different societies approach issues related to intimacy and pleasure. This multicultural perspective greatly enriched my clinical practice and helped me develop a more inclusive and comprehensive approach. A topic I often discuss in my practice is the issue of asexuality. Many people are surprised to learn that the absence of sexual desire can be a valid and healthy orientation. As a physician, my role is to help each person understand and accept their own sexuality, whatever it may be, as long as it does not cause harm to themselves or others. Modern sexual medicine also recognizes the importance of consensual, non-monogamous relationships. In my clinical practice, I see many couples who choose alternative relational arrangements, such as polyamory. The key is that these choices are made consciously, consensually, and with mutual respect among all involved. One aspect I always address in my consultations is the importance of open and honest communication about sexuality. Many sexual problems stem from the difficulty of discussing desires, boundaries, and expectations. As a healthcare professional, I work to create a safe environment where these conversations can happen naturally and constructively. The issue of female pleasure deserves special attention. For a long time, female sexuality was neglected by traditional medicine. Today, we know that the female orgasm is a complex and multifaceted phenomenon involving not only physical aspects but also psychological and emotional ones. In my research at the Mayo Clinic, I contributed to studies that expanded our understanding of this topic. Sexual medicine has also made significant strides in understanding male sexuality. Contrary to old stereotypes, we now know that men also have a complex and multifaceted sexuality that goes far beyond purely physical aspects. In my practice, I work to deconstruct harmful myths about masculinity and sexual performance. A topic I always address with my patients is the importance of sexual self-awareness. Understanding your own body, recognizing its signals, and respecting its limits are essential for a healthy and satisfying sexual life. This journey of self-discovery is unique for each person and should be approached with respect and sensitivity. The digital age has brought new challenges and opportunities for the expression of sexuality. As a healthcare professional, I stay updated on the transformations in relationships and intimacy mediated by technology. It is crucial to address these topics with a balanced perspective, acknowledging both the benefits and potential risks. In the next chapter, we will explore how this knowledge about sexual diversity can be applied in clinical practice, promoting a more inclusive and effective approach to sexual health. We will discuss concrete strategies to create a welcoming and respectful care environment for people of all sexual orientations and expressions. As a specialist in sexual health, one of the most valuable lessons I've learned throughout my career is that communication is the foundation of any healthy relationship. In my practice in Chicago, I often observe how a lack of proper dialogue can negatively impact the intimate lives of couples. During my residency at the Mayo Clinic, I had the opportunity to participate in a pioneering sexual therapy project that emphasized the importance of communication between partners. The results were remarkable. Couples who learned to openly discuss their needs and desires showed significant improvements not only in their sexual lives, but also in other aspects of their relationships. One of the most important aspects I address in my consultations is the need to create a safe environment for dialogue. This means establishing a judgment-free space where both partners feel comfortable expressing their thoughts and feelings. During my specialization in Europe, I learned specific techniques to facilitate this type of communication, which I now share with my patients. The issue of consent is fundamental in any intimate relationship. In my lectures for young healthcare professionals, I always emphasize how consent should be an ongoing conversation between partners. It's not just about an initial yes or no, but a constant dialogue about boundaries, desires, and mutual comfort. An interesting discovery we made in our research is how the quality of communication directly affects the production of hormones related to pleasure and emotional bonding. When partners feel truly heard and understood, there is an increase in oxytocin production, which further strengthens the emotional connection between them. In my clinical practice, I developed a special protocol to help couples improve their communication about sexuality. I start with simple active listening exercises, where each partner learns to listen without judgment and express their needs clearly and respectfully. It's impressive how these basic skills can transform a relationship. One important aspect I always address is the issue of expectations. Many problems arise when partners have different expectations about their sexual lives and fail to communicate them effectively. During consultations, I work with specific techniques to help couples align their expectations in a realistic and healthy way. Nonverbal communication also plays a crucial role in intimacy. In my classes at the medical school, I always emphasize how body language, facial expressions, and touch can communicate as much as words. Learning to read and respond to these signals is a fundamental skill for a satisfying intimate life. A delicate topic that often arises in the office is the issue of sexual fantasies. Many people feel ashamed or guilty about their desires and fantasies, which can create barriers in communication with their partners. My role as a physician is to help normalize these feelings and facilitate a healthy dialogue on the subject. The digital age has brought new challenges to communication in relationships. In my most recent research, I have been studying how technology can both facilitate and hinder intimate communication between partners. It is important to find a healthy balance between digital and in-person communication. During the group sessions I conduct at the hospital, I often observe how different couples face similar challenges in communication. A technique that has proven particularly effective is scheduled quality time, where partners set aside specific moments to discuss their intimacy, free from external distractions. In my international experience, I have observed how different cultures approach communication about sexuality. It is fascinating to note that, regardless of cultural context, the basic principles of effective communication remain the same: honesty, mutual respect, and a willingness to listen. In the next chapter, we will explore how these communication principles can be applied in specific situations, such as conflict resolution and negotiating boundaries in relationships. We will discuss practical strategies to overcome common barriers in communication about sexuality and intimacy. In my 15 years of experience as a urologist and andrologist, I have witnessed a true revolution in how we approach sexual health. The modern era has brought not only new challenges, but also extraordinary opportunities to promote a healthier and more satisfying sexual life. One of the most significant changes I observe in my clinical practice is the growing awareness of the importance of sexual health prevention. During my consultations at the medical center in Chicago, I dedicate considerable time educating my patients about preventive practices and regular checkups. This proactive approach has proven essential for maintaining good sexual health throughout life. Technology has significantly transformed the field of sexual medicine. In my clinic, I use advanced diagnostic and treatment resources that were unimaginable a few decades ago. High-definition ultrasound exams, precise hormonal tests, and minimally invasive treatments are just a few examples of how technology has benefited our patients. A fascinating aspect of modern sexual medicine is the increasing understanding of the connection between sexual health and overall well-being. During my specialization abroad, I participated in research that demonstrated how sexual problems can be early indicators of other health conditions. This discovery revolutionized the way we approach the diagnosis and treatment of various conditions. The issue of stress and its impact on sexual life is a recurring theme in my practice. Modern life, with its multiple demands and constant pressures, can significantly affect sexual performance and desire. I have developed specific protocols to help my patients manage stress and maintain a healthy sexual life even during challenging periods. One of the most rewarding aspects of my profession is being able to follow the evolution of available treatments. Today, we have a variety of therapeutic options that can be personalized for each patient. During my lectures at international conferences, I always emphasize the importance of this individualized approach in treating sexual issues. The internet has brought a democratization of knowledge about sexual health, but also some challenges. As a healthcare professional, a significant part of my work is helping my patients navigate the vast amount of information available online, separating scientific facts from myths and misinformation. In my clinical practice, I have observed a significant increase in young people seeking guidance on sexual health. This new generation is more open to discussing intimate issues and seeking professional help when needed. It is inspiring to see how taboos are gradually being broken, allowing for a more frank and productive dialogue about sexuality. Modern sexual medicine has also given special attention to mental health issues. During my residency at the Mayo Clinic, I participated in studies that demonstrated the strong connection between emotional well-being and sexual health. Today, a holistic approach that considers both physical and psychological aspects is fundamental in my clinical practice. One topic I always address with my patients is the importance of self-care. In the modern era, with so many distractions and commitments, many people neglect their sexual health. I developed a specific health education program that helps my patients incorporate self-care practices into their daily routines. Modern sexual medicine also recognizes the importance of inclusion and diversity. In my practice, I care for people of different sexual orientations, gender identities, and relational arrangements. This diversity enriches my clinical practice and allows me to offer truly inclusive and respectful care. The latest research in sexual medicine has revealed fascinating discoveries about the plasticity of desire and human sexual response. During my postgraduate studies, I participated in investigations that demonstrated how our brain and body can adapt and evolve in response to different sexual experiences and stimuli. In the next chapter, we will explore how these modern discoveries can be applied in practice to promote a more satisfying and healthy sexual life. We will discuss concrete strategies for incorporating the advancements of modern sexual medicine into our daily lives. As a specialist in sexual health, one of the most significant discoveries in my career is that self-awareness is the key to a fulfilling and satisfying sexual life. In my practice in Chicago, I dedicate a significant amount of time guiding my patients on the importance of understanding their own bodies and their responses to different stimuli. During my specialization in Europe, I came across groundbreaking research on sexual neuroplasticity. These studies demonstrated how our brain can develop new connections and patterns of sexual response throughout life. This discovery is particularly important because it debunks the idea that our pleasure patterns are fixed and unchangeable. A fundamental aspect I address in my consultations is the issue of personal timing. Each individual has their own rhythm of arousal and sexual response, and it is essential to respect these individual differences. During the therapeutic groups I coordinate at the hospital, I always emphasize that there is no normal standard of timing for pleasure. Body awareness is another topic that deserves special attention. In my clinical practice, I have developed specific sexual mindfulness exercises that help people connect more deeply with their bodily sensations. The results have been surprising, with many patients reporting significant improvements in their sexual satisfaction. An interesting phenomenon I have observed is how sexual self-awareness is directly linked to self-esteem and overall well-being. During my research at the Mayo Clinic, I documented cases where developing a more positive relationship with one's sexuality led to improvements in various aspects of life, from interpersonal relationships to professional performance. The issue of female pleasure deserves special attention. In my lectures to healthcare professionals, I always emphasize how the anatomy of female pleasure has historically been neglected by traditional medicine. Today, we know that the clitoris is a much more extensive and complex organ than previously thought, with branches that extend throughout the pelvic region. For men, self-awareness is also crucial. During my residency, I participated in studies that showed how performance pressure can negatively affect the male sexual experience. I work with my patients to develop a healthier relationship with their sexuality, free from demands and unrealistic expectations. A fascinating aspect of sexual self-awareness is its connection to hormonal production. Recent research I participated in demonstrated that individuals with greater body awareness tend to have more balanced levels of hormones related to pleasure and well-being. This is yet another example of how the mind and body are intrinsically connected in the sexual experience. In my clinical practice, I have developed a special protocol to assist in the process of sexual self-awareness. I start with simple breathing, exercises, and body awareness, gradually progressing to more specific techniques of sensory exploration. The goal is to create a solid foundation of self-awareness upon which a satisfying sexual life can develop. The topic of sexual fantasies also deserves special attention when we talk about self-awareness. During my postgraduate studies, I researched how fantasies can be a powerful tool for self-awareness and sexual development. It's important to normalize this aspect of sexuality and understand its natural role in healthy sexual development. A theme I always address in my consultations is the importance of maintaining a curious and experimental attitude toward one's own sexuality. This doesn't mean pressure to engage in specific practices, but rather staying open to discovering new aspects of oneself throughout life. This approach has proven particularly effective for long-term couples looking to renew their intimacy. The connection between sexual pleasure and overall health is another aspect worth highlighting. In my most recent research, I have documented how individuals with greater knowledge and acceptance of their sexuality tend to exhibit better overall health indicators, including more controlled blood pressure and improved immune response. In the next chapter, we will explore how all this knowledge about pleasure and self-awareness can be applied in practice to build more satisfying relationships and a more fulfilling sex life. We will discuss concrete strategies for integrating sexual self-awareness into the context of diverse relationships and different life stages. Throughout my career as a specialist in sexual medicine, I have witnessed extraordinary transformations in how we understand and experience human sexuality. The future ahead is even more promising, with scientific and technological advancements that promise to revolutionize our understanding of pleasure and sexual well-being. In my most recent research at the Mayo Clinic, I have been exploring how artificial intelligence is transforming the diagnosis and treatment of sexual health issues. Advanced algorithms already help us identify patterns and correlations that were previously overlooked, enabling more precise and personalized treatments for each patient. Regenerative medicine is another area that promises significant advancements in the field of sexual health. During my last visit to research centers in Europe, I came across preliminary studies on the use of stem cells for the regeneration of tissues and nerves related to sexual function. These discoveries could revolutionize the treatment of various conditions that affect intimate life. A fascinating aspect of the future of sexuality is the growing integration between biology and technology. In my practice, I already use virtual reality tools for the treatment of sexual anxiety and specific phobias. The results have been impressive, with success rates surpassing those of traditional approaches. Neuroscience is also opening new horizons in our understanding of sexual pleasure. Recent research in which I participated demonstrates how different regions of the brain interact during sexual experiences, providing valuable insights for the development of new treatments and therapies. A topic I always discuss in my lectures is how technology is transforming intimate relationships. Dating apps, connected devices, and other technological innovations are creating new forms of connection and intimacy. As healthcare professionals, we need to be prepared to guide our patients in this new landscape. Preventive medicine is becoming increasingly sophisticated in the field of sexual health. Through genetic analyses and specific biomarkers, we can now identify predispositions to certain conditions even before they manifest. This preventive approach has revolutionized the way we care for sexual health. In my clinical practice, I have observed how telemedicine is democratizing access to specialized sexual health care. People who previously lacked access to specialists can now receive qualified guidance through online consultations. This evolution has been particularly important for patients in remote areas or with limited mobility. Sexual education is also undergoing a technological revolution. Educational apps, interactive simulators, and online learning platforms are making knowledge about sexuality more accessible and understandable. During my classes at the medical school, I frequently use these tools to train the next generation of professionals. One exciting aspect of the future of sexuality is the increasing personalization of treatments. Through the analysis of data and specific biological markers, we can develop highly individualized therapeutic approaches. This precision in treatment has provided superior results compared to traditional methods. The issue of sustainability is also making its way into the field of sexual health. In my most recent studies, I have been investigating how more sustainable products and practices can be integrated into sexual health care without compromising effectiveness or safety. As I conclude this journey through the universe of human sexuality, it is important to emphasize that, despite all the technological advancements, the essence of sexuality remains deeply human. Technology and science are powerful tools, but they should always serve the purpose of fostering deeper connections and more meaningful experiences.